Okay, so good afternoon, good evening to everyone that's joined us for today's Daily Lightning session. This is our 22nd session, and today is the 2nd of September, 2020. So it's always a pleasure for us, Francois and myself, to have you join us for these sessions of experience sharing, of troubleshooting, of advice and counsel and mutual support. So as you're joining, maybe what we'll ask you to do is just to type in your city and your country in the chat so we know where you're connecting from. And then, of course, we have our Q&A icon if you have any questions to ask. But before I move forward, I have a question to ask 6 of you that are in the room with us today. Where are you as far as finalizing your project, revising your initial project is concerned? Have you received the feedback from your peers concerning your project? Have you been able to see the feedback? How good was it to you? Was the feedback helpful? Was it useful? How did you find the feedback? So I may just want you to raise your hand if you can, or type in your response in the chat. Just tell us, have you received, have you seen the feedback, the peers feedback for your project? That's the first question. What did you think about the feedback? Has it been useful to you? That's the second question. So you may want to type in your answers in the chat. And right now I'm saying welcome to you, Edak, that's joining us from Kenya. Always a pleasure to have you with us, Eda. All right, so I was just asking a question before. Where are you as far as revising your final, your project is concerned? Did you see the feedback that was sent to you by your peers? Was the feedback useful, helpful to you as far as improving upon your work is concerned? So as I said, you could type in your answer on the chat or just raise your hand, and it will be a pleasure for me to invite you to unmute yourself and share your experience with us. So now here is, if you're still having trouble seeing the feedback from your peers on peer grade, here is a video tutorial that is very helpful, that will help you, show you exactly where you need to go to get that feedback. And I'm just going to paste the link on the chat. So I'm going to paste the link on the chat. If you could just click on that link, and then you take you to a tutorial that will show you how to view, to see the feedback that you receive from your peers as far as your project is concerned. And under normal circumstances, you should receive 3 feedbacks because you got 3 peer reviews. But even if you don't have up to 3, that should not stop you from going ahead to revise your work. All right, so because why are we insisting on that? Because this week you have one mission, you have one focus, you have one objective, which is to revise and submit your final project by Friday, 4th of September at 11:59 p.m. Geneva time. That is the deadline, and this is a certification requirement. So it's very important for you to take this seriously and go ahead and do so. And maybe also remind the peers. I was just checking before the session, the number of submissions that we have already received for the final project, and for now they are just 68. 68 out of over 300 scholars that submitted the initial project. That number is still small, and we are less than 48 hours, just about over 48 hours before the deadline. So please do not hesitate. Go ahead and revise your project. And what do you have to, what do you need to do? What do you need to focus on? That is base your revision on the comments of the feedback that you received from your peers. The comment that you received from your peers, use them to improve upon their work. If the suggestions from and remember, they are just suggestions. You have to weigh them in the light of the context in which you're working and see if they can help you to attain the objective that you have. There also may be comments that will help you to better formulate your specific challenge, and better justify it, better formulate your objective and the actions that you want to carry out. All right, and now I'm seeing a comment from just feedback from 3 years. The feedback was very helpful to me.
Je t'entends plus. Non, tu as disparu. Charlotte, on t'entend plus. We cannot hear you, Charlotte. Charlotte? Oh, yeah. Charlotte? We can't hear you. Mm. Charlotte?
Hi, Francois. Unfortunately, I lost my internet connection. I hope you can get me now.
Now you're back 5/5.
All right, so I'm really sorry for that. Those are circumstances beyond your control. The internet connection is very tricky these days. And before I went off, I was reading a comment from the chat from Josephine Mutai that says, I have received feedback from 3 peers. The feedback was very helpful to me, and I started revising today. We'll probably submit tomorrow. So right now, I just hope that Josephine is in a position where she could talk to us so that she will be able to tell us about her project and maybe the feedback she received. But before she does that, I was just saying that while you're receiving revising your project, you should pay attention to the feedback that you receive from your peers and also focus on action. How will you take your project into action? How are you going to implement? Is that project actionable? And I also received, there is also this comment from Joyty that says, I found all 3 reviews useful in finalizing my project. So since these sessions are mainly for you to be sharing your experiences with us, I'm going to invite you now to raise your hand if you want to tell us about the feedback that you received from your project and about maybe how it's going to be helpful and useful to you to improve upon the project that you're going to submit as final project. But before we go ahead with that, and while waiting for you to indicate by raising your hands, I'm going to turn and say good evening to Francois and say thank you, Francois, for joining in and just taking over while I lost my connection a short while ago. Good evening, Francois.
I have to admit I didn't take over. I was just praying for you to come back. So I was a silent prayer. I'm glad you're back. So that's a first comment. And I'm glad to see the participant today and to see that there was the people who commented that they found the review, the peer review very useful. I think as we have seen in the past, I think the peer review is as much useful when you do the peer review of 3 projects as well as when you receive peer review from 3 scholars. So this is a very good news, and I hope everybody can benefit from the reviews. Of course, I would say reviews are people who are not in your context. They try to understand your context when you make the little summary about the situation, and they bring their own experience, and it may be a valid comment, or it may be not in line with your context, but that's your decision on what you take and what you don't take from the peer reviews. But I think I consider it as a fantastic new approach to assess project and to improve project and increase the chance to be implemented. As Charlotte said, some critical elements are your project has to address a very specific challenge. You may face many challenges with COVID and immunization. You have to choose one, justify it with figures, with observation, but you have to choose one and you have to feel accountable to what you're going to achieve. It's your project. It's not the project of the health center. If you're at district level, it's your project. And in terms of action, make sure you have variable action and not generic terms, which are often training, planning, promoting. These are more strategy. What we expect is if you choose to promote, how you're going to promote, what are the action steps you're going to do to promote the vaccination for women to come back, to stop fears, etc., as we heard often. So over to you, Charlotte, for listening to what participants have done and where they are, even if they found useful feedback that they can share.
All right, so thank you very much, Francois. And I'm seeing JT, your hand is raised, and you indicated earlier on that you received 3 very useful reviews, and you finalized your project. So I'm going to ask you, JT, the questions are there on the screen. You may just want to remind us who you are and where you work, and then you share your screen if possible. You summarize your project briefly, and based on the feedback you receive from your peers, you tell us what you have decided to change as, to improve upon your final project and why. So JT, if you can unmute yourself, you have the floor.
Hello.
Hello.
Hi.
Hello. Myself Jyoti. I'm a nursing tutor in District Hospital Pune. I'm in public health service since last 20 years. I submit my initial project with too much mistakes in it, though I refer the rubric, but it is too much confusing in initial stage. While going through the daily lightning projects and our evening sessions, it is very clear how to use rubric, and I get all 3 peer reviews, which are very useful for me. Very first, in challenge session, I only note the one challenge and give justification in that column only. Then in goal, it is not smart goal, and it is related directly related with the challenge. So it is difficult for me in initial stage. How do I make it smart? But due to the peer review, I
Aye. Jesse, we can't hear you. Have you lost connection?
Unfortunately, it's as if we lost her because we've lost her. She's no more in the room. So probably internet connection issues, and that's a problem with most of us. So we are really sorry that we have lost Joyty, and we do hope that she'll be able to join us again during this session. But earlier on, I'd invited Josephine to unmute yourself. Josephine, if you can do that, because you, okay, Jyoti is back, that's great. So, all right, Jyoti, thank God you're back. So please, can you just go ahead?
yeah. So now in final project, I think I make the goal as a smart goal with the defining number which I want to increase and in within the time limit. Then in justification, I give the justification for all the problems, but I now identify the major problem, major challenge which I have to focus, and I make the action plan with that challenge and that goal with objective. Then I find the resources also, and I created the
Oh.
Aye.
So unfortunately, we have lost Joyty again, and it's a real pity. But if I could get what she said from her, she said she initially her project had a lot of errors, especially when it came to writing out the challenges and justifying. And then she also talked about her goal that was not smart, but from the feedback she received, she's able to write now a clear, a smart goal that has to do with attaining a measurable objective. So I don't know if you were able to get as much from her shared experience, Francois.
No, but I think this is all purpose. We are here to facilitate as pair or as a co-host the improvement of the project. And obviously the peer review was extremely, and the lightning session make it more clear than the rubric. So we're glad to hear that. And we're glad that she's been able to make a smart objective when before it was obviously not, it was missing some element of the smart for an objective. I wish I could have the illustration of the objective she's got now as an illustration for everyone, and that would be useful. And then maybe get some action that she has decided to take with verb of action to achieve the objective she set for herself.
Yeah, exactly, Francois. Thank you. Those were the same questions that were going through my mind because I was like, okay, maybe she should share with us the SMART goal that she wants to focus on right now, and then some action steps. But unfortunately, it won't be for today. We do hope, since we have 2 other sessions this week, that's Thursday and Friday, we do hope she'll be able to make it in one of them so that she gets to share these with us. But I really want to thank you, Charity, for making the effort. And we do understand, we are sorry about the internet connection issues, and we do hope they get better soon. Right now, I just want to say welcome to you who are just joining us. And you all know this is the final week for the exercise 1 of the peer hub, and it's during this week that you are going to be revising. You have to revise and submit the final version of your project before Friday, 4th September at 23:59 p.m. Geneva time. So we do hope you'll be able to make it then. I'm seeing a question on the Q&A from Amsalu Shifera that says, how do we set target if we don't have a baseline figure? I think that's a good question. And thank you, Amsalu, for asking that question. Francois, do you get the question from Amsalu? He said, how do we set a target if we don't have a baseline figure?
Very good question, and I have no answer. No, I would say I would love to hear the objective, and maybe I could guide better if I understand the objective set. What you will have to show with your objective, at least that it's kind of an achievement. If you cannot show progress from where to where, I don't know what your objective is, but I don't know if your objective is to stop rumors. That's very clear. Now, maybe as monitoring the number of rumors every day or every week, you will be able to monitor over time if you manage to achieve 0 fears or a reduction of fears over time. And maybe for you is to reduce by 80% the number of fears within 2 months. But I don't know exactly, can you specify your objective? And maybe we can discuss it a bit. It's a very good question.
So Amsalu, I'm just giving you the possibility to unmute yourself, and I do hope the internet connection. All right, your mic is already on. So over to you, Amsalu.
Thank you, Charlotte, and thank you, Dr. Francis. My objective is actually to improve the practice and adherence of COVID prevention methods among the primary healthcare workers. I mean, those particularly who are providing immunization. Currently, as per the observation, we do see that they are not adhering regularly, wearing the masks, as well as rubbing hands with sanitizer after immunization. And in some cases also, there is negligence on maintaining the physical distance among clients as well. So these are the observations from the health facilities at primary healthcare level. And my objective was actually to improve those practices.
Thank you. Now it makes it, thank you very much for being so specific, Amsalu. And of course, improve is very difficult to judge if you don't have a monitoring indicator. What proportion of your staff are respecting? And maybe you will have 3 sub-indicators when you monitor progress over time. It could be useful is to set a goal, even a gut feeling goal. Adhesions, you know, ideally, but I know it's not possible, you want 100% wearing mask, you want 100% and sanitize, and you want 100% respecting distance, but that's the dream goal. If you wanted to set a realistic goal, maybe you would be happy with 80% and you will monitor for each of those measures, because one can respect one measure and not do the other ones. So maybe you could be very specific. In fact, you just say, what would for you, knowing your context, would be a great achievement? 50%, 60%, 80% for each of those preventive measures by the health worker. But what will be important is that in your actions, you will have to monitor the progress toward wearing masks and find a way to monitor others through supervision or supervisory visit of someone that at the end of the day tell you, the head of a health center, this is what I observed during the day. 2 of my 4 vaccinators were not respecting distance, but they all were wearing masks, for example. I think you have to monitor what is happening, even if you don't have a baseline data. But what would be for you a doable, knowing your context, knowing with your information, your observations, what would be, you think, a great achievement, but a doable one, a realistic one?
Okay.
What would be, what's your feedback? What would you say?
I think that is very important. I mean, what I'm just looking is face mask. Using face mask is supposed to be universal among the healthcare providers, but particularly this time. So actually, it varies from place to place. In some areas where the health workers fear that there is some positive cases are reported from their health facilities or around that area, they tend to use for sometimes. In some areas where there was no completely test of COVID and then not reported COVID cases, they are more reluctant. As I have previously said, also in some areas, in hot areas,
I remember.
yeah, they also tend to frequently put out, the masks. So I think I'm preferring the mask one because it has to be, number one, the supply should be available, and the health facilities and the health system across the level of care should consider the face mask for healthcare workers as essential drug or as essential supply and ensure the availability. Number two, the health workers need to practice at least whenever they provide the service for clients. And number three, they have to, adhere with those practice and, adapt with the new norm. That was what I was thinking. Over to you. Thanks.
I think, Amsalu, I understand why it is difficult for you, because you are at national level, I suppose.
Yeah.
And you are looking at the whole country, a country of 90+ million inhabitants with various different regions and without the basic information per region. So you could have an overall goal, maybe less ambitious. I know 100% is important, but then for you will be to focus with your observation, the report you get, focus on areas where you have a problem. At least in selected area where you consider at high risk not wearing the mask, where you have a lot of population, you could decide, yeah, I think I may reach nationwide 70%, but I would like 80 or 90% in selected area where I know we are facing problem for the problem you mentioned, the cause you mentioned. Is it possible? Do you have such information? Is it already in urban area or rural areas you have the most problem with the mask?
In urban area, it is improving. In rural areas, it is on and off. And definitely, you raised a good point. We have some 14 target zones where we are supporting deployed and embedded consultants with the government office. And I'm using those consultants to monitor and to adapt, to support the health system in those areas. Actually, that's I'm working at national level, but we have consultants in very few areas,
But
like 20%
you
or
know,
something.
Amsalu, this has to be your project. And you know, at national level, it's very hard to get it everywhere. Prioritization, like you said, is excellent. And you have justify your prioritization because you have people to support the implementation of the mask and to report to you the progress. So I think you have it all. You know, so making your objective in areas where you have support makes a lot of rational, and if you do it well, maybe it would be a good lesson for expanding to other area, which may be at a higher level of performance in wearing masks. So I think, yeah, focus on those zones where you, and say maybe in those zones with my consultancy, I want at least 90% wearing masks each time they do immunization session. And your consultant should be a good staff, human resources to monitor with some specific guidance, monitor when they visit a health center.
Please,
Excellent.
Francois, I'm sorry, I had a question. I was just asking, is there a possibility that could be done? He could do it like a pilot in I don't know, one region or district, and then see how it goes before, since it's at the national level, but start with a pilot and then expand elsewhere. What do you think about that, Francois Amsalo?
Alors, you know, my view on pilot tend to last forever. I'm always a bit worrying. I like the word phasing in, you know, where you start somewhere, but you already have a plan to expand. Now, Amsalu has got some 17 zones where he's working. I don't know how big population is covered, how many health workers are covered by his project to have them vaccinators wearing masks. This has to be decided by him. But of course, if he start there and he's seeing that the approach is working, nothing prevent to move in the second medium risk area to improve the situation. Amsalu, over to you.
Yeah, I think the population is about 20% of the country's population, like 24.8 million. There are about 943 health centers and about 4,000 health posts as well. But there is also an opportunity, as Ethiopia is a decentralized system. Some regional states are imposing the use of face mask among the population as well. So health workers are supposed to be an example to wear. And there are also cases from the health workers. Now, I mean, some of the health workers are tested positive for COVID. Also that fear induced them to use. But in some remote areas, like in hot, less sparsed settlement areas, they seem reluctant. I am in the field currently, I mean, on supportive supervision in some areas. So we don't have concrete data on that, but I observe those utilization or putting at the chin when you speak with other people and those malpractices.
But in your observation, what proportion of the one who observed had this putting the mask under the chin? Do you think it was a very rampant behavior, or it was only 10%? Or?
More than 10%. My estimation, like 1 out of 3, I can say, okay, in some areas.
It's a good estimate.
Sorry to interrupt you, but I'm seeing a very interesting comment on the chat from Joyty, and I was just about to ask you that question. Is to say use of IPE checklist to monitor practice may be useful. And I was just about to ask that, do you do IPC evaluation in health facilities in your context, maybe to evaluate the health worker knowledge on IPC and on the use of PPE? Because there's a scorecard for that. Do you use that? Because that could help you to evaluate. You already know the level of the use by health workers and also their know-how. So
Exactly, we have we have incorporated this issue after, by the way, this peer hub training. I mean, we had the checklists for supportive supervision at session level, at community level, and then at also data verification. I mean, at the session level, we have incorporated the availability of PPE as well as IPC practice when they are doing immunization. So we incorporated just currently, I mean, very recently, like we didn't even share for all the health workers.
That's very
this is a product of, by the way, your the peer hub lesson.
This is excellent, and we are glad that when you're together, you get ideas, far more ideas than we are alone in our office. So that's a bit peer hub benefit, and I'm glad to hear that. And it's good that you get this. One thing, you are at national level. Your role in your project is to see what you can do to help the challenge that you have defined. And now you are going to have some people to help you. How you make those people by your action as helpful as possible, and as helpful as possible to monitor where you are today when they will make their first report, and where do you want, and you want to see a constant progress with the report over time. Now you say 1/4 of population in Nigeria is quite a huge. That's the population of Madagascar that you described. So basically it's huge. Now, if you want to start first to understand in different contexts, because one is a hit, the other one is lack of knowledge, you want to understand, maybe you, as Charlotte was saying, instead of pilot, you phase it in and you get very quickly feedback. And when it works, you start. But I think your role, you start expanding, but your role is really to help to facilitate the work of your consultant, and that will work in your health facility, that will help the vaccinated to have the right behavior with the mask. So in your project, see how and what action you're going to do to help this far away objective of getting the wearing of the mask by most of the resistant to do that for X reasons. So your role is really at national level to guide as much to facilitate the implementation of your objective. Now,
exactly,
that's what you have. You're not in the front line, or you're just anecdotally from front line when you do supportive supervision, but you have to count of your staff and what action will make your objective, which is great, and you could be taking place and making progress every week, and getting the indicators that you have already listed, the availability of mask and wearing, and getting who is going to monitor that, at what frequency, and report to you, basically.
Yeah, actually, we have the established system for monitoring. There are 4 areas that the consultants are supposed to monitor. One is the session monitoring. The second one is community convenience survey. They took like 10 to 20 children from each village and verify for the vaccination. The third one is data validation. Validating the tally sheets, the registration book, and the reporting format. And the fourth one is again verification. They took 5 children from the health facility registration book, the names of the children. They go to the community with the names of the children from the health facilities and cross-check whether those children are actually received the vaccination, which is registered in immunization registration book, and check whether that is also transferred to the home-based registration card. So we had that system, and they do at least, we send the transport with the vehicle 10 days per month for all consultants, and they're doing at the ground level. So the opportunity is to incorporate those PPE, availability of PPE and practice and adherence of the IPCs, particularly during the session monitoring. So that is why what I am incorporating on already available system.
You know, yeah, and this is excellent. Now, if you incorporate the availability or the wearing of a mask means it's available, maybe the cause is not availability, but maybe when you do your communities with your mothers, you have a good system to monitor by asking the mothers, were the vaccinator wearing a mask when he gave you immunization? You know, try to get as simple as possible in the indicator you will use. Is it possible to introduce the indicator, or it's too late, asking the mother, was a vaccinator wearing a mask? Or do you think it will be biased?
No, I didn't thought of this one. Actually, this is also one of the triangulation method. I mean, looking the session is one and the other, and verifying from the community is also an important. And it's still, there is an opportunity to incorporate this question on the community, I mean, convenience survey part. I think
Yeah.
that is very important as well. Thank you so much, Francois.
No, thank you. But you have a good monitoring system for your objective. Up to you to decide what kind of objective you feel, given your level, given the 24 million, or you want to go smaller. What would you expect would be, you would consider a good achievement with the result of those convenience survey and the report? Would it be, if you have a 70%, will be a success story because you said it could be 30% now? Up to you. In 3 months, if you get 30%, it's a fantastic achievement. And even if you get part of it, it's already a big achievement. Even 60 out of 70%, you're on track.
Yeah,
But
thank
you
you
can
so
be
much.
more
And
try
All
to be
right, so
realistic.
okay, I will try to be realistic. I have to also consult the consultants who are doing those issues.
Yeah.
Actually, we have the number of health facilities to be visited per month within 10 days. So probably I can calculate, I can use that, the number of health facilities visited per month times 3 months or 4 or 5. So
Excellent.
thank you for your insights.
okay, so thank you, Francois, and thanks to you, Amsalu. I am sure that all here in the session were able to gain from your intervention. Now, I'm glad to see that Joyty was able to join us. And Joyty, I would just like you to unmute yourself once again, because you have put in all the effort to join this session. So please, can you just unmute yourself and go ahead with your presentation?
Hello.
Hello, Jyoti.
So now in my revised project, I state the goal as to provide online training to all, to at least one medical officer and 30% healthcare worker in each public health facility who are directly involved in immunization activities on routine immunization and recent protocol and guidelines of immunization in context of COVID pandemic in a month. Then I state the justification. In action plan, I put 2 specific action related to the goal. The objectives of the actions are increase immunization coverage by improving knowledge of healthcare workers on COVID-19, and second is incentives to the support staff. So for first objective, the specific action is online training of healthcare providers and motivators. Details I stated. Healthcare workers are being provided with training on rational use of PPE, arrangements in the immunization clinics to maintain social distancing, supervisory visit of medical officer during immunization session, which is previously not occurring for all the immunization sessions. What to do if baby is sick, about hand hygiene, about demand of vaccines, open hand policy in COVID-19, counseling of caretakers, 4 points to tell to caretakers, etc. State government is providing revised guidelines and training module. So we are thinking of provide the soft copy of training module to the trainees. Next is the incentive to the support staff. We have ASHA workers, that accredited social health activists, which work as a mediator in community and the healthcare worker. They are provided only rupees 150 for each immunization session. So if they are provided with the incentive in COVID pandemic, they work much better as they are working each and every health activity. If it is NCD, it is MCS services, family planning services, immunization services, general surveys, and all in each all healthcare services they are being involved with very less incentive. So if in COVID-19 they are being provided with some incentive, it may be the money, or it may be some other future promise. So it may help to accelerate their service in improving the immunization status or coverage. So likewise, I revised my plan as per the peer review. I found it is useful for me.
So thank you very much, Joyty, and I'm sure Francois has listened to you, and he'll probably have one or two tips to give you on how to really fine-tune your work well. So over to you, Francois.
Yes, thank you very much, Jyoti, for sharing the evolution of your project from something which was a bit cloudy at the beginning and getting very clear on what you just presented with the help of with useful input from the peer reviewers. And obviously you've made a great progress, and your plan is going is on track to be in the right direction. I was a bit the only thing was where I was still not very clear was between your objective and your challenge, which, you know, when you say provide training online to X number of things, that could be a perfect objective. And to respond to the challenge of not knowledge about all the preventive measure and etc. Now, when you put it as justification, I was not fully clear, but then you're going to provide this challenge, and you need actions to achieve these objectives, this goal. And your actions were very specific, and I congratulate you for that, because you developed the action test, you know, online. I was just wondering who is going to do the online training, you know. There's a lot ongoing, but it's not easy, is not as good as face-to-face. Sometimes when you want to demonstrate the use of a mask online is more complex. You need connections, and maybe some people have no connection. I don't know the local context, so there's some challenges there. But I think make sure that in the action, you are very clear on who will do what and how and with whom. That will be, and over which time. That will be, and that will complete a very decent project. And make sure you're going to monitor, you have an action on monitoring that your objective, which was very concrete, how many you want to train online, make sure that you have a way to monitor that it is implemented. The online training is taking place. People are responding to the online training and getting it. So I just, again, want to say it's a great, you have a great project, a very concrete project, and good luck to finalize your project and deposit it.
Yeah, I want to add some point. Yeah, in action plan, I also stated that for those who are not having the good network coverage, The training institute must provide them the recording of the training and the soft copy of the module also. So, and also the number of the trainer to whom they can contact for the queries.
Excellent. That's a very good additional point, that it's your monitoring, and monitoring is key. When you implement a project, you need to follow up to see if all what you plan, the action steps are taking place, and that's to be done regularly to be sure that you have all the benefit of your main actions, which was provide training and which was your objective with a concrete number of people you want to train. So excellent, and thank you very much for sharing.
So thank you very much, Joyce, and wish you all the best with the finalization and the submission of your project.
Okay, thank you, ma'am.
All right. So I really want to thank you all for being here this evening. Thank you, Francois, for always being here to counsel and to give advice and follow up on the work that scholars are doing. I want to thank you, Joyce, Londiv, and Amsalo Shifero for your pertinent questions. That's for one. For two, for sharing your experiences. We did learn a lot from that. So just a gentle reminder, once again, remember you have up till Friday to submit the final version of your project, and please do not delay. This is, it would be unfortunate if you really take out the time to go through this exercise, do all the tasks, accomplish all the tasks, and in the last minute you don't receive your certification because you forgot to submit the final version of your project. So please also share this information in your various country groups. Remind your peers and your colleagues from your country groups that this is revision week and that they have up till Friday to submit the final version of their project. So please, and if you have any difficulties, technical issues, remember the technical support session tomorrow at 11 a.m. Geneva time with Alain Blaise Tatinko, and Francois and I will be here again tomorrow at 6 p.m. Geneva time. Until then, I just wish you stay safe and wish you all the best with the revision of your project. And I do hope that tomorrow I'll have more than 80 people, 90 people, 100 people who have submitted the final versions of their project. Thank you very much, and goodbye. See you tomorrow.
Thank you very much, Charlotte, and all the participants for your wonderful questions. Bye-bye.
Thank you very much.
Thank you.
Francois, you're the one that will end the session.
I'm not sure I do that.
There is a red button that is end.
Yes.
Yeah, you click there, you say end meeting for all.
Okay. Thank you very much for your participation and sharing your experience. It's very, and you know, I understand a bit more your context each time you talk. So thank you very much for sharing. Talk to you another time. Bye-bye. Have a nice night.
Bye.